Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. A quick note whether I am audible and visible, everyone. Yes. Am I audible and visible, everyone? Okay, that's great. So here we are in this today's YouTube live session where we are going to discuss basically the list of the must-do topics for the exam. Like how you should prepare for radiology and all those points. Okay, yes, thank you so much, Tarun. I think it's long time we are meeting here, right? So yes, glad to see you all as well, though virtually, right? So we are going to discuss the topics and there are some important topics whether you are a FMG student or a NEET PG aspirant. This list is basically must do for all the exams. Okay, this is a must do for all the exams. Now, so let's start with the discussion of the topics here in radiology that are important. So these are the various systems that you are supposed to read in radiology. First is the general radiology part, which is basically specific to radiology and you will not do anywhere else. Then integration of radioanatomy is something which is very, very important, right? They give you a CT image and they ask you the anatomical structure. CT, MRI, X-ray is given, right? Especially in the FMG exam, you would see this very frequently. Even in that, the musculoskeletal X-rays are asked frequently. Okay, respiratory, CVS, neuro, OB-GYN, these are the multiple systems that we have in radiology. But at the outset, let me tell you that the trend of the questions that we are seeing in radiology now are more of clinical radiology questions. That means that they are integrated with other subjects like surgery, medicine, pediatrics, OB-GYN, all of that. So now what we are seeing, generally the questions have associated clinical history also given. So many times when you are not able to identify from the image, the clinical history helps you to come to the diagnosis. Okay. So if I have to give you an example of that. So previously, the question used to be asked as a neonate presenting with hydrocephalus and heart failure, high output cardiac failure. So if you have a neonate with hydrocephalus and heart failure, what will be the diagnosis in that case? Let me see that. So quickly, we will brush up through this list ka important keywords as well, the clues there in the questions as well, right? Though not completely, but then it will be like a rapid revision sort of thing. Tell me, what will be the diagnosis if you have a neonate with hydrocephalus and heart failure? I hope I'm able to see the live chat. Yes, yes, this will be available later on also. Okay. So Lakshmi says it's gonna be Dandy Walker. No, it's not going. It's the diagnosis is not Dandy Walker, guys. You must have read this in pediatrics. If you have read pediatrics, yes, absolutely right, Vishnu. It is vein of Galen malformation. Okay, it is vein of Galen malformation because vein of Galen malformation is the AV fistula in the brain, and that is why there is hydrocephalus. AV fistula anywhere causes high output cardiac failure. So that is what you have. Now, previously, this question used to be asked as a clinical history, clinical scenario. Now that the images are also asked in the exam, so the classical image that they give you for vein of Galen malformation is this sagittal image with the dilated vein here going into the straight sinus. Okay, so this is an example of a question that even if you're not able to identify the image, but the history should help you in making the diagnosis. Another example where history is very, very important, the example of a question in NEET PG 23, the recent NEET PG exam, where the image of a CT scan image was given and a hemorrhage was given. Okay, that hemorrhage looked like EDH. Okay, but the history that was there was the history of, it was a chronic history of 2 weeks, right? Fall 2 weeks before. So clinically, we know that EDH is an acute presentation associated with significant trauma and adjacent bone fracture. SDH is venous bleed, so it can occur even with trivial trauma. So in that case, history was the major clue there in helping you diagnose that this is SDH and this is not EDH. So remember that radiology, whenever you are reading, it has to be integrated with the clinical features also. Okay, so that is one learning here. Now, starting with what are the important topics system-wise in radiology. So we'll go one by one. In general radiology, what is important is the principles of the various investigations, right? The contrast media and the identification of the investigations, right? An image is given, a machine is given, and they ask you what investigation is this. So can someone tell me what is the principle of ultrasound? It is something called as piezoelectric effect. Okay, the principle of ultrasound is piezoelectric effect or the pulse echo principle. What is the principle of PET? Anyone? Remember, this is all whatever I'm going to discuss are the ones which are the previously asked questions. So basically, this is going to be like a brush up of all the important points. The principle of PET is annihilation coincidence circuit. Okay, previously asked question, annihilation coincidence circuit is the principle of PET. In contrast media, what is important is iodinated contrast, non-iodinated contrast. Example of that is gadolinium, which is the contrast used in MRI, right? Then you have barium. Important point, remember that barium is contraindicated in perforation. Okay, barium is contraindicated in perforation. In iodinated contrast media, you should also know about the iodine particle ratio, though it has not been asked in the recent years, but it is always better to know that. Identification of investigations, ERCP has been asked, MRCP has been asked, DEXA machine, mammography, BMFT, barium meal follow through, and even PET-CT has been asked both in FMG and NEET exam. How do you identify PET-CT ka image? Remember that it's basically going to be a CT image that is the white bone, and in that white CT you will also see the orange areas which are lighted up, right? That is how you will identify PET-CT. How will you identify BMFT? Barium meal follow through is basically for small intestine. Okay, it is for small intestine. So these are the important points that you should know in general radiology. Plus also remember that which investigation has radiation, which investigation does not have radiation. So like ultrasound and MRI do not have radiation exposure. Remember that. Okay, ultrasound and MRI do not have radiation exposure. You should remember that. Now, going on to the next one. What is important in radioanatomy? Okay, what is important in radioanatomy? So in radioanatomy, from the musculoskeletal aspect, what is asked in the exam is, okay, just a minute. Some issue with the video at my end. Yeah, okay. So identification of carpal bones is important, right? Which is capitate, which is hamate, all of that is very, very important. So you should know how to identify carpal bones. In the tarsal bones, it is important. The recent exam had identification of navicular, which was asked. In the elbow, like in FMG exam, it was asked to identify capitulum. Okay, that is present adjacent to the radius head. In shoulder, you should know that which is the acromion and which is the coracoid process. In the pelvis, twice or thrice in the FMG exam, pubic symphysis has been asked. The question has been about what is the type of joint at pubic symphysis. Remember, it is secondary cartilaginous joint. Okay, it is secondary cartilaginous joint. Now, important in neuroanatomy. What is important in neuroanatomy? Identification of midbrain has been asked. Midbrain has that heart shape or Mickey Mouse appearance. Ventricles are important, aqueduct is important, and very, very important in neuroanatomy is the identification of basal ganglia, right? So frontal horn ke baaju mein you have caudate nucleus, then you have the foramen of Monro opening into the third ventricle, you have thalamus there, right? And lateral to the internal capsule, you have lentiform. So this has been asked in the exam many times. Next one, important in the CT chest is identification of those three mediastinal vessels there. The superior vena cava, the ascending aorta, and the pulmonary artery. Remember, from right to left, the sequence is SAP. Okay, from right to left, the sequence is SAP. So we have superior vena cava, ascending aorta, and the pulmonary artery. That is very important. Identifying the heart chambers is important. Can you tell me which is the anterior most chamber of the heart? Which is the anterior most chamber of the heart? Anybody? Yes. I need some answers from you. So tell me that. Very good, Vishnu. It is the right ventricle. That is why you read in surgery also that a stab injury basically will lead to RV rupture, RV injury. So if you're given a CT or MRI image, the heart is basically going to look like this. This is the right side of the image. This is the left side of the image. The heart points towards the left side, the apex. And these are going to be the four chambers of the heart. This is the anterior aspect where you have sternum. This is the posterior aspect where you have vertebra, right? I think I'm hiding this image. I hope you can see it now, right? Remember that the chamber which is just behind the sternum, the anterior most will be right ventricle. Adjacent to that is right atrium. Right ventricle का बाजू में left ventricle and you will have the left atrium. So remember that the posterior most chamber of the heart is the left atrium. And left atrium के पीछे here is where you have esophagus which is present. Right? So remember that left ventricle के बाजू में here you have esophagus. So that is why for which chamber, this is a previously asked question, for which chamber do we do trans-esophageal echocardiography? It is done for left atrium. Okay, it is done for left atrium. So these are some important things that are asked frequently in radioanatomy. Going to the next one, the respiratory system. These are the important points, important topics in respiratory radiology. Sarcoidosis. What you should know for sarcoidosis is? What should you know for sarcoidosis? Very important clinical history that is also mentioned there. Bilateral hilar lymph nodes, increased ACE levels, increased calcium levels is mentioned. So remember, it is a case of sarcoidosis. Bilateral hilar lymph nodes. Miliary TB is frequently asked in the exam, right? So the dot millet-like appearance. But remember that it is not specific for TB. Miliary mottling has many other causes. For interstitial lung disease, what is the history generally given? A patient with progressive dry cough. Remember, it's a dry cough, shortness of breath. Progressive shortness of breath is what the patient has. So remember that what is the investigation of choice for interstitial lung disease? It is HRCT. Okay, the investigation of choice for interstitial lung disease is HRCT. And what do you see in the UIP pattern? We see honeycombing appearance. Honeycomb pattern is what we see in UIP. For bronchiectasis, the history that is generally given is an elderly patient with productive cough. And what sign do you see in bronchiectasis is tram tract sign or signet ring sign. Again, for bronchiectasis, remember it is HRCT, which is the best investigation. Okay? Yes. Correct, Anshika. Because interstitial lung disease is a restrictive lung disease. So the FEV1 by FVC will not decrease. Asbestosis is important from pathology perspective, also from radiology perspective. Remember, as base affects the base of the lung, that is the lower lobe of the lungs is what it affects. Rather, which is that the occupational lung disease which affects the upper lobe, that is silicosis. Okay, the one affecting the upper lobe basically is silicosis, which is similar to TB. In asbestosis, you have shipyard wala history, occupational history. And what do we have in asbestosis is calcified pleural plaques. What tumor can develop? Mesothelioma is the most specific one. Next important in respiratory radiology is consolidation versus collapse. Important point, remember that in consolidation, there is no shift of structures. In collapse, there is pull of the structures. The fissural pull, the tracheal deviation to the same side is what we see. Next, you have the Silhouette sign, which has been asked in the exam very, very frequently. The Silhouette sign is basically the loss of the border sign. So If you have an opacity obscuring the right heart border, the pathology is in the right middle lobe. If you have the opacity obscuring the left heart border, the pathology is in the lingula, right? We don't have the left middle lobe. The pathology is in lingula. So these two are asked frequently. In the recent NEET PG also it was asked, the right middle lobe consolidation. Air bronchogram sign again has been asked many times. Where do you see air bronchogram sign, guys? Where do you see air bronchogram sign? Yes. So you see the bronchi filled with air in the background of the white lung. Okay, in the background of the white lung. So any cause of consolidation basically gives air bronchogram. It could be pneumonia, right? It could be respiratory distress syndrome, or correctly because it causes white out lungs. Any cause of consolidation, pulmonary edema, pulmonary hemorrhage. Most important to remember is air bronchogram is not seen in pleural or mediastinal pathology. It is not seen in extraparenchymal pathology. It is a sign of intraparenchymal pathology. Okay, it is a sign of intraparenchymal pathology. Okay. Going on to the next one. In the cardiovascular system, what are the important topics? Coarctation of aorta is important with integration. Remember the association of coarctation of aorta with Turner's syndrome. Okay, it is associated with Turner's syndrome. The lower limb blood pressure is less than the upper limb blood pressure. The patient can have intermittent claudication, right? The patient can have intermittent claudication. And what do you see in coarctation is the narrowing of the aorta, the figure of 3 sign. And very, very important, what notching do you see? The superior rib notching or the inferior rib notching? Remember, it shows the inferior rib notching. Okay, it shows inferior rib notching. Heart failure ka chest X-ray findings and pulmonary edema. What appearance do we see with pulmonary edema on the chest X-ray? What appearance do we see with pulmonary edema on the chest X-ray? Correct. It is the bat wing appearance. Okay, it is the bat wing appearance where you see bilateral, perihilar, symmetrical opacities. It is bat wing appearance. Heart appearances in various congenital heart disease is something which is very, very important. Like boot-shaped heart is seen in tetralogy of Fallot. Figure of 8 appearance of the heart is seen in TAPVC. This is also frequently asked. Egg on side is seen in TGA. Box shape is seen in Epstein's anomaly. All of these are very, very frequently asked. Pulmonary embolism overall is an important topic. Investigation of choice. What is the investigation of choice? CT pulmonary angio. What is the screening investigation? It is D-dimer, which is the screening investigation, right? And in pulmonary embolism, basically you will see filling defect in the pulmonary artery. A bedridden patient having calf swelling, now having chest pain, we should always think of pulmonary embolism. Signs of left atrial enlargement, very, very important and frequently asked. It causes the straightening of the left heart border. It causes the splaying of the carina. Remember the important sign here, which is the double density sign or the double right heart border sign. And also remember that it can compress on esophagus. It can lead to dysphagia. It can compress on the recurrent laryngeal nerve, the left recurrent laryngeal nerve, and it can affect the voice as well. Okay. So remember that left atrial enlargement is the one which can lead to dysphagia, because we saw that left atrium ke baaju mein is where we have the esophagus. Okay. Coming to the neuro and the head and neck part, what is important for neuro and head and neck? Before that, let me quickly tell you about the updates on the platform here, guys, before I forget that. So remember that we have unlock offer which is back, where you are getting 25% off on the subscriptions here, and we are starting with the ACE next batch on 21st of June. So now you get the 6-month subscription, which is originally at 19K, you get it around 14K, and this is valid till 17th of June. You can use the code Dr. Nikita when you are subscribing to avail this offer. Okay. And also we have NEET PG vitals also available. What are vitals? Vitals are the recorded videos that are there. Okay. Vitals are the recorded videos and which are like properly recorded. And you also have the scholarship test, which is there upcoming on 18th of June. The top 3 learners will get the free mentorship sessions from the top faculties. Okay. Right. Going back to the neuroradiology and what is important in neuroradiology, stroke is very, very important. Tell me that what is the first investigation in stroke? What is the first investigation in stroke? First investigation in stroke is non-contrast CT. Ischemic stroke versus hemorrhagic stroke, how do you differentiate? Ischemic stroke on CT is hypodense. Hemorrhagic stroke on CT is hyperdense. Okay, ischemic is hypodense, hemorrhagic is hyperdense. And this is what you should know, very, very important. What is the most sensitive for ischemic stroke? For acute infarct, what is the most sensitive is diffusion weighted imaging. Acute infarct shows restricted diffusion. Next one, in the brain tumors, craniopharyngioma, they will describe it as it's a suprasellar mass. In a child, this is common. Remember all the CCCs. It is a tumor in a child with a cystic component with calcification. In the center is where you see that. So remember, it is craniopharyngioma. Meningioma, what sign do you have in meningioma radiologically? Remember the dural tail. Meninges, dura. Remember, it has a dural tail sign. GBM is also called the butterfly glioma. So remember, it crosses the midline, right? It crosses the midline and it involves a corpus callosum. Neurocutaneous syndromes are important. What is that neurocutaneous syndrome where you have bilateral vestibular schwannoma? What is that neurocutaneous syndrome where you have bilateral vestibular schwannoma? It is NF2. Remember, bilateral 2, it is NF2. In tuberous sclerosis, what do you have? The calcified subependymal nodules. What brain tumor can develop? It is SEGA. Okay, it is SEGA which can develop. In paranasal sinuses, what is important is the anatomy. The CT anatomy along with the variations Hellar cell, Onodi cell, Agar-Nasi cell, it is important. X-ray views are important. Waters view, Cardwell view. Remember, Cardwell view is the best X-ray view for frontal sinus. Okay, it's the best for frontal sinus. No, today we are just discussing the list of the topics, and Satna, I'm just telling you the important one-liners. In hemorrhage is something which is very, very important for all the exams. Differentiating SAH, EDH, SDH, and IPH is what is frequently asked. Diffuse external injury is something that you should know, that a patient with road traffic accident patient with poor GCS, CT scan normal, and MRI is going to be a better investigation. MRI will show petechial hemorrhages. Infections in important which are asked as TB, neurocysticercosis, herpes simplex, and CMV. Remember, for TB, it shows the lipid peak. The key word for TB is presence of basal exudates. NCC, basically it is starry sky appearance that you see. Herpes simplex encephalitis. Tell me that what lobe is commonly affected in herpes simplex encephalitis? What lobe is commonly affected in herpes simplex encephalitis? Correct, it is the temporal lobe. Very good, Shri. That is the temporal lobe, recent NEET PG question. What calcification do you have with CMV? Remember, V for ventricle. It is periventricular calcification is what we see with CMV. Periventricular calcification. Next are the important signs in neuroradiology, like you have Wilson's disease. What sign do you have in Wilson? Remember, Wilson has a face like giant panda. So, face of giant panda sign. Huntington's disease has boxcar ventricles, and multiple sclerosis has Dawson's fingers. Okay, multiple sclerosis has Dawson's fingers. So, this is like the must know from neuroradiology. Next, what you have is the important system again, OB-GYN. Important from the breast here is BIRADS. And like if you have fibroadenoma, how does a fibroadenoma look like on ultrasound? It is wider than taller, it is hypoechoic, and it can show popcorn calcification on mammography. What BIRADS will be? Yes, Dipanjali, this is like a last minute revision and the list of all the important topics. Fibroadenoma BIRADS will be basically BIRADS 2 or BIRADS 3. It's a benign lesion. And remember that what is the important finding for CA breast? Presence of microcalcification is something which is very, very important. If you have microcalcification present, then you will go to BIRATS 5. It is highly suspicious of malignancy. Next important in OB-GYN are the hysterosalpingography images, including the uterine anomalies. But if the question is what is the gold standard for uterine anomalies? The gold standard for uterine anomalies is hysteroscopy plus laparoscopy. Best non-invasive investigation is MRI. Okay. Neural tube defects, important. What sign do you see in neural tube defect? Is the lemon sign and the banana sign, as in the recent INICT. Anencephaly, what sign do you see in anencephaly? The frog eye appearance. Remember, you should supplement with folic acid to prevent the neural tube defects. Twin pregnancy, where do you have lambda sign and T sign? Remember, laddu, that is lambda sign is seen in DD, dichorionic diamniotic, and remember T for MODI, monochorionic diamniotic. H-mole, it's a complete H-mole which gives what appearance on ultrasound? Basically is the snowstorm appearance. Okay, that is the snowstorm appearance that we see. Next one, the normal early pregnancy identification of G-sac. That is the first thing that appears. Then comes the yolk sac, and double bleb sign has been asked. Double bleb, what is the double bleb formed by? It is the yolk sac and the amnion. Okay, it's the yolk sac and the amnion within the gestational sac which forms the double bleb. Okay, the yolk sac and the amnion forms the double bleb. Okay, and also remember ectopic pregnancy is important overall. And what sign do you have with ectopic? It is the ring of fire on Doppler. Okay, ring of fire on Doppler. Next one, coming to nephro part, the urinary tract system. Renal lesions is something which is very, very important. Angiomyolipoma, as the term says lipoma, that means it is fat containing. And remember that fat has negative HU value. It will appear dark. RCC will be solid without any fat, and cyst will be basically non-enhancing. That is how you will differentiate the three. Kidney calcification has been asked in the recent exam very frequently. Either it can be a staghorn calculus, which will be seen on X-ray. Putty kidney, which is seen on TB, which has that lobulated appearance. And medullary nephrocalcinosis, which has those triangular sort of areas of calcification, as in the recent INICT. Remember, hyperparathyroid is one of the causes. Okay. Now, if I tell you a question that you have a patient in whom even on delayed IVP, ureter is not seen. What is the diagnosis in that case? Even on delayed IVP, the ureter is not seen. Then what is the diagnosis in that case? That means the contrast is not going into the ureter because there is a block here. So that means it's a diagnosis of PUJ obstruction. Okay, it is a diagnosis of PUJ obstruction. IVP appearances are important. Where you have a cobra head appearance, which is seen in ureterocele. Horseshoe kidney is frequently asked, and polycystic kidney disease, enlarged kidney with the multiple cyst, is what you have with the ADPKD. Okay, ADPKD. What history do you have in VUR generally, guys? In VUR, generally the history is a child with recurrent UTI. Okay, it's a child with recurrent UTI. Tell me, what is the investigation of choice for VUR? What is the investigation of choice for vesico-ureteric reflux? It is MCU. Okay, the investigation of choice for vesico-ureteric reflux is MCU. PUJ obstruction, we have already discussed. Also remember some important bladder appearances like the Christmas tree appearance, which is seen with neurogenic bladder. Okay, the Christmas tree appearance, which is seen with neurogenic bladder. Next system that we are discussing about is GIT. What are the common esophagus pathologies which are asked radiologically? Achalasia is the most common, where you see the dilated esophagus with bird beak appearance, and the gold standard investigation is manometry. Diffuse esophageal spasm, where you have corkscrew esophagus. Zenker's diverticulum, which is the upper esophagus diverticulum going posteriorly. CA esophagus is the irregular narrowing with shouldering is what is asked. Esophageal perforation, remember the important point here that in any perforation, barium is contraindicated. So what we give is iodinated contrast. IHPS or CHPS is important where you have the history of a child with non-bilious vomiting. Remember the investigation of choice for CHPS is ultrasound. Okay, because there's no radiation. So in neonates and children, you prefer that. Inflammatory bowel disease, ulcerative colitis and Crohn's. Remember with ulcerative colitis, lead pipe colon is important. And with Crohn's, we have the string sign of Cantor, which is important. BMFT identification is important, has been asked. Okay, tell me that what sign do you see on barium enema in diverticulosis? What sign do you see in barium enema in diverticulosis? Anyone, what is the sign in diverticulosis? So diverticuli are basically the outpouching coming from the colonic wall, right? So it appears like a sawtooth appearance. Okay, what it gives is the sawtooth appearance. Very, very important. Okay, this is the sawtooth, not the molar tooth. Okay, this is the sawtooth appearance. Where do you see apple core appearance in the colon? Where do you see the apple core is basically the irregular narrowing that is seen with carcinoma colon. Okay, carcinoma colon. In intersusception, what is the sign that you see on barium enema? That is the claw sign and the coiled spring sign. Both of these have been asked in the exam. It is claw sign and coiled spring sign. Okay, and what sign do you see on ultrasound? It is the target sign. Inner bowel, outer bowel, that gives the target sign. Okay, that gives the target sign. Next one, coming to the hepatobiliary system. In the liver, important lesions that are asked is hemangioma. HCC, what is important for HCC is, remember, it is early arterial enhancement, which is important. Caroli's disease, C for C, is the central dot sign. Abscess gets asked frequently. And hydatid cyst, remember the floating membranes that give the water lily sign. Again, the recent NEET PG exam, remember water lily sign is hydatid cyst. Biliary tract, the gallstones are important, which are identified by posterior acoustic shadowing. CBD stones ke liye, the investigation of choice will be MRCP. And you will see the lucency, the filling defect in biliary bile duct. This was asked in INICT exam. Primary sclerosing cholangitis, remember, gives a beaded appearance and it has association with ulcerative colitis. ERCP versus MRCP difference is important to be known. In pancreas, acute pancreatitis, very, very important. Remember, we have bulky pancreas in acute pancreatitis. Any organ which is acutely inflamed will be enlarged in size. So we have bulky pancreas. Investigation of choice here is CECT. Okay, it is CECT. For chronic pancreatitis, remember the C and the C again. It has calcification and it has the chain of lakes appearance. Okay, it has calcification and chain of lakes appearance, right? Going on to the next one here, musculoskeletal system. Osteomyelitis, important, identifying the sequestrum. Remember, it is the dead bone which appears radio opaque, so it appears more white. Hyperparathyroidism, remember, it causes salt and pepper skull. That is important to be known. Hyperparathyroidism. In the skull, hair on end appearance is seen in hemolytic anemia. Punched out lytic lesions are seen in multiple myeloma. Cotton wool skull is seen in Paget's disease. Okay, cotton wool skull is seen in Paget's disease. In dislocation, shoulder, it is important. Where do you see the light bulb sign in shoulder dislocation? Where do you see the light bulb sign in shoulder dislocation? It is the posterior dislocation. Hip ka dislocation, important, anterior and posterior. Remember, anterior is Faber. It has abduction. Posterior has father. It has adduction. Okay, so both of these have been asked in the exam. In arthritis, important is ankylosing spondylitis, right? The appearance of the bamboo spine, the dagger sign is frequently asked. Remember, ankylosing spondylitis is inflammatory, so it will cause morning stiffness, HLA-B27 positive, right? And extra-articular manifestation is uveitis is commonly associated. Important for RA is sparing of the DIP. DIP is never involved. Gout ke liye important, remember it involves the great toe. The first MTP is the most common joint which is involved. For scurvy versus rickets, remember scurvy has white line of Frankel which is present and it has Wimberger's ring which is present. Important to differentiate from rickets which has flaying, cupping and fraying. Okay. Next one, and now coming to the nuclear medicine. What is important in nuclear medicine is the names of the nuclear scans. What nuclear scan do we do for parathyroid adenoma? Remember it is Cysta-Mebe scan. For Meckel's diverticulum, remember it is technetium 99 per technate scan. Okay, what do we do is per technate scan. For pheochromocytoma, anybody, what scan do we do for pheochromocytoma? What scan do we do for pheochromocytoma? It is MIBG scan. Okay, it is MIBG scan. Muga scan has been asked in the exam before. It is done for left ventricle function. MDP scan, diphosphonate like bisphosphonates going to the bones. Remember, this is the bone scan. Technetium 99, MDP scan is done for bones. Very good, Rohit. Thyroid scan. For thyroid scan, we have iodine 123, which is used for diagnosis. Iodine 131, which is the therapeutic one. Okay, the treatment one, the therapeutic effect is because of the beta rays. Half-life also you should remember, the radioisotopes ka half-life is important. Now next one, coming to radiotherapy. What is important in radiotherapy is knowing about gamma knife. Okay, so gamma knife is basically stereotactic radiotherapy. Remember that there is no surgery which is done there. Okay, and who invented gamma knife is Lars Lexell. Okay, it is Lars Lexell who invented gamma knife. Half-life of radioisotopes is important, like iodine 131. Remember the half-life is 8 days. Previously asked question, Bragg peak. Bragg peak is seen with PR protons. Bragg peak BR is seen with PR. It is seen with protons. Which are the pure beta emitters radioisotopes? Remember psychiatry ka PSY. Phosphorus 32, strontium and yttrium. These are pure beta emitters. So remember also the isotopes which are used as permanent implants. Also important here, very, very important is remember what is radiosensitive, what is radioresistant. This is frequently asked. Like neurons are radioresistant because they do not divide. Okay, so remember that neurons are radioresistant. Cancer cells are dividing, so they are radiosensitive. Okay, they are radiosensitive. So all this is important. And then you have radiation hazards. How do you differentiate deterministic from stochastic effects? Remember stochastic effect, CHA, basically it occurs by chance. Okay, so what is included here? CACA, it is cancer, radiation-induced cancer, radiation-induced mutations, congenital malformations. All these are stochastic effects. Where you do not know at what dose this side effect will occur. Deterministic means the threshold can be determined. Okay, the threshold at which the side effect occurs can be determined. So remember, all this is very, very important and must know in radiotherapy. Now coming to emergency radiology per se, what is important? Very, very important. Pneumoperitoneum, pneumothorax are the favorite with the examiners. Pneumoperitoneum, the free air under diaphragm. Then you have the Wriggler sign. Then you have the football sign. All this is very, very important to be known. The management of the patient, first is the resuscitation, stabilizing the patient, and then is the surgery, laparotomy to be done. For pneumothorax, remember it is going to be black on X-ray or CT, and there will be visceral pleural line. The immediate management is the needle puncture, followed by putting the ICD in the 5th intercostal space, if it's a tension pneumothorax. And aortic dissection is something again which is very important. The important history there is if you have a patient with history of trauma with mediastinal widening, okay, history of trauma with mediastinal widening, think of aortic dissection. If you have a hypertensive patient with acute chest pain, hypertensive patient with acute chest pain with unequal pressures in the upper limb, think of aortic dissection. What is the investigation that you will do in this case? So remember, it depends on whether the patient is stable or the patient is unstable. If the patient is stable, patient can be taken to CT scan, so we can do CT. If the patient is unstable, then we have to do transesophageal echo. Okay, that has been asked in last year's NEET PG exam. Okay, that is important. Yes, very good. And what we use is Stanford classification. You have Stanford A, Stanford B. A for ascending aorta is involved. B for below the ascending aorta. Okay. A for acute emergency. The treatment for Stanford A is surgery. B for below and B for beta blockers. Okay. B for below the ascending aorta. And in the treatment, conservative management is what we do. If the patient is stable, there are no complications, then we can give the beta blockers. Okay, then we can give the beta blockers, right? Now coming to some important ones in the pediatric part of radiology, IHPS we have already discussed. This is very, very important. Congenital diaphragmatic hernia, where you will see the bowel loops pushing the heart to the opposite side in the thorax. In the RDS or HMD, basically you will have white out lungs, hypoinflated white out lungs. In battered baby, there will be presence of STH and multiple fractures of different ages is what is given in battered baby. Osteogenesis imperfecta, it's basically a young child with multiple fractures is what you have in osteogenesis imperfecta. Wings versus neuroblastoma is important again. Neuroblastoma generally has calcification also, which is present. Wings is the renal tumor, neuroblastoma suprarenal, and Wings is radiosensitive. Okay, remember Wings is highly radiosensitive. Okay. So, right, so that was, see, the purpose of today's session was to give you, now when you are starting the preparation, right, for the upcoming exam, let's say you are NEET PG 24, you are starting the preparation. So, before you start any subject, you should know that what are the topics that I should be focusing on in a particular subject, because it does not make any sense to read everything in and out, right? So you need to know the important topics, and so that was the whole purpose of having this session, where you get an idea that what are the important topics in radiology and how you should be going about this, about radiology. Okay. FMG 2023, I don't think that's happening, right? Okay. So thank you so much everyone for joining in. And again, a quick reminder about what's happening on the platform. So do not forget the unlock offer, which is there till 17th of June, and you are getting 25% off on the subscriptions. Okay. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, and keep winning. Thank you.